Adding additional note types in a patient's chart. When you come in to their chart, you click New Note on the right, and there's different note types that you can choose from. A quick communication note lets you just quickly add a statement that you wanted to add to their chart without generating a full note. A regular communication note is just a little more detailed, where you can then establish a priority for the note. A supervision note is for anyone working with an assistant that you want to document a supervision note information. Daily note is a normal visit note. Missed or canceled visit note types. Progress and recertification notes. So they're separate notes. When you would add them, you would add a progress note or the recertification, which would update the plan of care. Then there is a reevaluation note. Discharge. There are two discharge notes. Full discharge, if you saw them. Quick discharge is a non-visit discharge note. And then you also have a vital note, which is a way of just documenting vital signs for a visit for a patient, if that would be needed, as well as an RTM note if you're doing remote therapeutic monitoring.